Hi, I'm Dr. Jason Gray, and in this video we're going to talk about muscle stiffness and tightness and limited mobility in the calf and in the ankle, which is of course going to be this area here. And I think it's important to keep in mind that the things that we talk about here are not only going to be relevant with pain, injury, as well as just some general symptoms of stiffness and tightness in the calf and in the ankle itself, but issues here are also going to be really common with foot pain and foot disorders as well. So in this video, we're going to take a look at how to assess this area, and then we'll talk about some treatment options and some really effective stretches and exercises that can help address any issues that we might find. But before we get there, let's just take a quick look at the muscles that live in this area so we know what we're dealing with here and so that the rest of the video is going to make more sense. Now, when most people think of the calf, they think of the outer, more superficial muscles. This would be the gastroc and the soleus muscles, which then form the Achilles tendon, which of course goes down to attach on the back of the calcaneus. Now, to be sure, these are very important muscles that we absolutely need to assess. But I think it's also important to understand that there are three other muscles that live underneath the gastroc and soleus. Collectively, these are part of the deep compartment of the calf. And just to quickly review these three muscles, they include the tibialis posterior, the flexor digitorum longus, and the flexor hallicus longus. Now, the really key thing to point out here is that all three of these muscles originate deep in the calf, but instead of inserting onto the back of the heel like the more superficial Achilles, all three of these deep compartment muscles travel down past the ankle and insert onto different parts of the foot. More specifically, the tibialis posterior inserts into the arch of the foot. The flexor digitorum longus passes all the way to the second, third, fourth, and fifth toes, while the flexor hallicus longus inserts all the way onto the bottom of the big toe. We'll see in a moment why it's so important to understand the anatomy of all these different muscles. But here's the really important point to consider now. The calf is not just a single muscle, but it consists of a group of muscles. And what this means is that when assessing and treating the calf, we need to consider all of these muscles. And this is true when considering treatment as well. So in other words, from a treatment perspective, we need to direct our treatment not just towards the calf as a general region, but instead towards the specific muscles or tissue that are causing the problem. And so now that we know this, let's turn our attention on how to assess this area. All right, so now that we've looked at the anatomy, let's take a quick look at how to assess this area. So we're going to start with our patient just simply in a standing kind of split lunge position. The leg that we're trying to test is going to be this lead leg. And from here, all we're going to have the person do is we're just going to try to keep that foot flat, and they're just going to kind of lunge forward. We just want to see how far this knee can come forward. And ultimately, what we're trying to assess here is how far the knee is in front of the toes. Now, just as a quick FYI, we're just doing this from a freestanding position. It's often very effective to do this leaning against the wall. That way, it's just a little bit of an easier assessment to see how far the knee is in front of the toes. All right, but let's take a look at what we're looking for. So again, as the knee comes forward, first off, just to keep in mind, we need to make sure that that foot stays very flat. This is especially true for the heel. As soon as those muscles start to become a little bit tight, there's going to be a tendency where that heel starts to lift and the weight shifts more towards the forefoot. And we want to make sure that we're assessing this in terms of how far the knee can come forward, but we make sure that this heel does not come even slightly off the ground. And again, as I said, the first thing that we're looking for is going to be how far this knee is over the toes. And under normal circumstances, we want this to be several inches, at least let's say 3 to 4, maybe even 5 inches beyond that toe to be indicative of a normal test. Now, there's a couple little ways we can do this. First off, when we're doing it with the toes flat, this is going to be more of an assessment of those outer superficial muscles. All right, this is going to be the Gastroc-Soleus and Achilles. But if we do find limitation there, we want to then differentiate, is that limitation because of that superficial compartment, or are those deep muscles playing a role? And if you recall from our anatomy discussion, the big difference between the superficial and deep compartment is the deep compartment is going to pass the ankle, go into the foot, and then attach onto different parts of the foot, particularly the big and the smaller toes. So this is how we can differentiate. What we're going to do is, before we have the patient lunge forward, I'm just going to slide my fingers underneath the four, in this case we'll start with the four smaller toes. We'll have them lunge forward again to that maximum range. And then from here, all we're going to try to do is try to see if we can lift those toes up off the floor. And what we're looking for simply is the ability of the toes to lift. If we find that they're in a maxed position, meaning that we've taken all the slack out of the muscles and they're at the limit of their range of motion, if we then go try to pull up those toes and they do not lift, it means that there is no longer any slack in that flexor digitorum longus muscle, which means that it's very likely that it's that flexor digitorum longus as opposed to just the superficial compartment that is limiting the motion. And we're going to have to be conscious to target this during our treatment and during our exercise protocols. Now, again, there's also the flexor hallicus longus, which is similar, but it goes to the big toe as opposed to the smaller toes. So to differentiate here, we can use the same procedure, but we're using the big toe. So again, we're going to try to slide our hand or our fingers underneath that big toe. Patient's going to slide forward as far as we can. Then from this position, we're looking to see, can we lift that big toe off the ground? If we can, it means there's still some slack in that muscle, so we're less worried about it being the limiting factor. But again, if there's no give in that big toe and there's no slack in that big toe, we're going to consider the flexor hallicus longus as a significant issue that we need to address. All right, so now let's go over some stretching and exercise options that we can use to help correct any dysfunction and any stiffness and restriction that we find. Now, when we go over these exercises, we're going to go over exercises to cover more of our one joint muscles. These are our superficial compartment, the Gastroc-Soleus-Achilles. And we're also going to go over some options to target more of that deep compartment, okay? But as we go through these, we're going to see that the theme is going to be very similar. So for each of these regions and each of these muscles, we're going to go over a mobilization, we're going to go over a basic static stretch, and then we're going to go over a more advanced contract, relax, or PALS version in order to help target this area. So let's take a look. So first, let's just start with our basic ankle dorsiflexion stretch, which is going to be a little bit more specific to target the superficial compartment. This is the gastroc-soleus and the Achilles tendon. Now, just as a side note, oftentimes I will have patients do this kind of leaning up against a wall, but just for the sake of convenience here, I'm just going to do this freestanding using a few sticks for support. So what we're going to do is we're going to have the calf and the ankle that we want to stretch to be our lead foot, and we're just going to have the foot nice and flat on the floor. And then what we're going to do is just simply lunge forward, and I'm trying to bring the knee forward over the toes. All right, and as I do this, I should feel a stretch in the back of the calf. But the form is really critical here. And again, these things that we're going to talk about with form are going to carry over to every single stretch and exercise that we're going to do through the rest of the video. All right, so one of the big things is we need to keep the foot and specifically the heel very flat on the floor. All right, so we want that weight to stay back on the heel. As people lunge forward, the tendency is going to be to shift just a little bit. And even if there's a slight little shift where that heel starts to come off the ground, it's going to make the stretch much less effective. Now, to help with that, it's also very helpful not just to kind of lunge forward in a passive way, but we want to almost pull the shin forward by contracting through that anterior compartment. Again, this is going to help with some muscle balance issues. It's going to help to create a deeper and more specific stretch on the back of the calf. And it really helps to keep that heel planted and the motion occurring right through that ankle joint as best we can. Now for our mobilization, I'm going to hold this just for a second or two, and then I'm just going to back off to release that stretch. Again, go forward, pulling with that anterior compartment, trying to get those knees straight over the toes. Hold for a second or two, and then come on back. Now, as we do our mobilization, this is what we're doing. We're utilizing those short 1 or 2 second holds just to kind of work that shin back and forth and create that stretch and that mobilization through the tissue on the posterior calf. But we can turn this into a more significant static stretch as well. So this is done in the exact same way. I'm lunging forward, pulling with that anterior compartment. Knee is going straight forward over the toes. I'm going to feel that stretch in the calf. But now instead of a back and forth motion, I'm holding for a longer duration. All right, so that longer static stretch and hold to create a little bit more stretch and a little bit more adaptation through the muscles. And typically for a static stretch, we're going to do this as a 3 times 30-second hold. Now finally, I can turn this into a contract, relax, or a pale stretch. And the idea here is we're adding contraction to that stretched tissue or to that stretched motion just to create a little bit more of a neurological release and a little bit of a deeper stretch on the tissue. So again, the setup in the initial motion is the same. Heel is flat, knee is going forward straight over the toes. Now I'm going to create that stretch into the back of the calf. Now, but what I'm going to do here is after about 10 seconds of stretch, I'm going to try to contract, almost like I'm pushing my foot and I'm pushing my toes down towards the floor. And as I do this, I should feel some extra tension through the foot and through the calf. I'm going to hold that push and hold that contraction for 10 seconds. Then I'm going to relax. And what I will typically find here is as I relax, but I haven't moved the angle of my shin or my ankle, I'm going to feel that the stretch is not quite as deep. And now I'm able to go forward just a little bit more into that stretch. I'm going to hold the static stretch for 10 seconds. And then I'm going to push down again. I'm trying to kind of push that foot into the floor, driving that forefoot down, feeling the muscles contract through my foot, through my calf, holding that contraction for 10 seconds, relax. And again, now I can typically go forward a little bit farther just to deepen that stretch and get a few more degrees of motion. And our typical prescription for these contract, relax, or these pale stretches is going to perform 4 to 5 of these contract and then relax and stretch cycles with each training session. Okay, so that's going to be our basic exercise options for the Gastroc-Soleus-Achilles. But as we've been talking about, there's a deep group of muscles deep to that superficial compartment that we need to be aware of. And from our review previously, we know that these muscles go to either the big toe, if we're talking about the Flexor Hallicus longus, or the 4 smaller toes, if we're talking about the Flexor Digiturum longus. So to target these muscles, we're going to create a bit of a pre-stretch or a preload through those muscles by essentially creating some stretch and a reposition of the toes. So let's take a look at first how to do this with the Flexor Digitorum longus group. So the key here is I'm going to create some pre-positioned extension through those toes, in particular through that metatarsal joint. And in this case, we're targeting the 4 smaller toes in order to target the Flexor Digitorum longus. So in this case, just for demonstration, I just have a round wooden dowel underneath my toes, but other options can be to wrap a washcloth around a pencil or a pen, for example, and we can play around with how thick that layering needs to be. The idea here is we want to try to get those toes back as far as possible to take all of the slack out. But we're starting in this position where the toes are extended, but my knee is still back. I haven't created any motion or stretch through the calf or through the ankle yet. Now, once we have the toes positioned this way, the exercises that we can perform are going to follow the very same patterns and sequences that we talked about with our basic standing ankle dorsiflexion stretch. The difference here is that the toes are extended back, but this is done prior to the stretch, so the actual execution of the stretches are going to be, as I said, very similar. So just as an example, in my standing position, I'm going to simply pull my knee forward over top of those toes. as far as I can, but again, keeping the heel flat on the floor and using some contraction through that anterior compartment to keep that good form. I'm going to hold that stretch for 1 to 2 seconds, and then I'm going to back off. If I'm doing my mobilizations, again, I'm going forward, holding that stretch for a moment or two, and then come on back. For my mobilizations, I'm able to perform 10 repetitions. Now, if I want to turn this into a static stretch, the setup and the position is very similar. The difference is in how we're executing the movement and the hold times. So for a static stretch, exact same thing. We're going forward, keeping the heel flat, trying to get those knees straight over those toes. I'm going to feel the stretch through the foot, through the ankle, through the calf. And now I can hold that stretch for a longer duration. As previously mentioned, the typical prescription here is going to be 3 repetitions of 30-second holds. And then finally, if I wanted to progress to my more advanced mobility version, my contract, relax, or my pails, again, the setup is very similar. We've got our toes back under that dowel. I'm going to slide that knee forward, keeping the heel flat, getting that stretch through the toes, through the ankle, through the calf. But from this position, after I do my initial 10-second hold, I'm going to add contraction. But in this case, what I'm going to do to focus the stimulus on that flexor digitorum longus group, I'm going to try to push or press those toes down into that dowel. All right, and that's going to try to help to isolate, again, the stimulus to those toe muscles, that flexor digitorum longus group. So as I go forward, I'm going to feel my stretch, hold that stretch for 10 seconds, and then I'm going to lightly press those toes down into that dowel. I should feel some contraction through the foot, through the ankle, through the calf, holding that contraction for 10 seconds, and then relax. As I relax, I'm going to try to bend a little farther forward to take up the slack in that muscle. And again, as we said with our basic ankle dorsiflexion stretch, our typical exercise prescription here is going to be to repeat 4 to 5 of these cycles within each training session. And then finally, to target the big toe, to target the flexor hallicus longus, again, it's going to be a similar procedure, but now we're trying to place the emphasis and the pre-stretch through the big toe. So again, in my example here, I'm going to continue to use my wooden dowel, but in some cases we might need to get a little bit pickier with the size of the object that we're placing under the toe. If a dowel is a little bit too big, we can use something smaller as a golf ball as an example, or to get something larger, even a lacrosse ball will work in some patients. But with this one, we do want to be a little bit picky. We want to get as much of that motion as we can, that extension through that first metatarsal phalangeal joint to make sure we're having an effect. But we want to make sure it's not propped up too high. And the really big key here is that we need to make sure that the toe is elevated, but we need to make sure that this first metatarsal joint is remaining firm on the floor. If the object is too high, it's going to end up tipping the foot, and it's going to make for a much less effective stretch. Okay, so again, the big toe is up, but that first metatarsal joint is planted firmly on the floor. And from here, it's going to be the same procedure. For our mobilization, we're going to bring that knee forward over the toes. Here, we're going to feel a little bit more stretch through the medial side of the foot, through the big toe, maybe even in through the medial part of the ankle and in through that calf. For our mobilizations, holding a second or two, and then we're going to come back. I'm going to go forward, we're going to hold for a second or two, and then we're going to come back. Again, for our mobilizations, we're typically going to perform 10 repetitions within each session. If we wanted to turn this into a static stretch, as the theme has been, the procedure and the movement is the same. The difference is the hold times. So for a static stretch, I'm going to go forward, get that tension, feel that stretch, and I'm typically going to hold this for 30 seconds, performing 3 repetitions. And then finally, if we wanted to turn this into our contract, relax, or our pails version, again, it's the exact same thing. We're going forward, feeling that stretch. The difference here being when we add our contraction, the focus is now on contracting through the big toe. We're trying to create some tension by pressing the big toe down into the dowel or into the ball or whatever it is you're using to prop that toe up. All right, so we're pressing down, holding that contraction for 10 seconds. Relax. As it relaxes, I'm going to try to go a little bit farther to try to take up the slack within that tissue. And as we've said, for these contract, relax, or PALs, the typical exercise prescription is going to repeat 4 to 5 of these contract, stretch cycles within each training session.